Healthcare Committee meeting. Our Sergeant at Arms today, if you all would just raise your hand when I call your name. Gary Bridges, Keith Cannon, Michael Cavanis, Cherie Hedrick, and Hal Roach. Every time I say Hal Roach's name, I think of, he's going to be a moderator or be an announcer on something. Hal Roach. Good talking. All right. We have 3 bills that we're going to hear today. Do we have pages here with us? They all left, didn't they? I think they did. Okay. We have 3 bills that we're going to hear today. The first is Senate Bill 357. And Senator Sari, I think you're presenting that bill. Yep, right there.
Start here. Thank you, Mr. Chair. Senate Bill 357, Pharmacist Collaborative Practice. We've talked a lot about access to care, scope of care in this healthcare committee so far this session. This fits right in with that theme. So North Carolina already has collaborative practice pharmacists. What that means is pharmacists who have specialized training can go work in team-based settings with doctors at hospitals or in practice groups. What this legislation does is expand some of the rules that are currently in place. We were originally a pioneer in this concept decades ago. We've fallen a little bit behind the curve with the way that we allow some of our pharmacy teams to treat certain patient populations. This expands it from single sites to multiple sites, different provider groups, and allows them to work on different healthcare products rather than just drug regimes. The population that will specifically benefit from this are those that are suffering from chronic diseases such as diabetes and hypertension. We have millions of our neighbors in North Carolina that are dealing with these. This is a cost-saving mechanism because a lot of what the work the CPP pharmacists do is helping manage that medication. This is about access in our rural communities. This is about utilizing our providers and being a multiplier of what they can do. Kindly stand for questions, and I'm also happy to report too that this bill has been worked on hard by various stakeholder groups. Unlike Danny Britt, who uses this very callously, I can say that I actually know of no opposition finally to this bill. I want to thank NCAP, who's here today, the Duke Health System, their pharmacy team, North Carolina Medical Society, and some other provider groups for working hard to get to a good piece of legislation I think will have a real impact on lives across North Carolina. Thank you, Mr. Chair.
Thank you, Senator. And I know you made yourself available to talk to anybody that wanted to talk about this.
That's right.
I appreciate that. I know we have some questions. Senator Adcock.
Not a question, a comment. Thank you, Mr. Chair, and thank you, Senator Sari. If we continue this is a big chip, and we continue to chip away at this access to care issue and helping our neighbors, as you say, millions of them, be healthier and increasing the bandwidth of our workforce. And our pharmacists obviously are a huge piece of that. I am so glad to continue to see these bills that do this. This is one of many that we've seen, one of many I hope we will continue to see. And I just want to say thank you for doing all this.
Mr. Chair, if I can make a comment too, Senator Hayes has worked hard on this in past sessions as well, and he's not standing up here today. I appreciate him letting me run this bill, but I do want to give credit to him for being a champion of this issue in past sessions.
Thank you. Senator Corbin, you had a question.
Thank you, Mr. Chairman. I appreciate the bill sponsors very much for bringing this bill forward. Thank you. And as you know, Mr. Chairman, I've been very supportive of these access to care type bills, and so I very much support this. I think it's a great benefit to rural North Carolina, which I represent, and I appreciate it. And at the appropriate time, I'd make a motion for.
Senator Corbin, I have an unofficial request from Senator Adcock. Can you all share that at the appropriate time? Okay. Senator Waddell.
Thank you. Thank you for bringing this forward. I've been working with several constituents concerning the access to care. And one of the things that we tend to see is when you mention these pharmacists, helping them to acquire the medications, anything as a follow-up after they take the medications and they start working with them. Sometimes there are other things that happen. Is there anything that they do to follow up with these constituents, the patients?
Sure, Mr. Chair. So that's a lot of what these pharmacists, that's what their job is. So oftentimes you go to the doctor, you see the doctor does the testing, they make a diagnosis, they put you on a course of treatment. Well, the doctor doesn't control what happens after you leave the doctor's office, and there are all sorts of determinants and other factors that go into that. Can you obtain that medication? Do you have the proper refrigeration ability to dose that ARP having some sort of contraindication or adverse side effect with another medication you're on, when you come back, if you need something tweaked, they can do that. So it's helping in lots of different ways make sure that medication is being used in the ways intended being used, and is having the results as well. And then the next time you come back, you've got access to somebody who has that specialized knowledge and training in that medication, your chronic disease state.
Thank you, that's very helpful.
Thank you. Senator Heiss.
Thank you, Mr. Chairman, and not to belabor the point, but for some reason in the practice of pharmacy, we've tried to squeeze pharmacists into being retailers. We reimburse pharmacists for counting to 30 and putting it in the right bottle. We make it to where a pharmacy practice is only successful selling sodas and candy bars and durable medical equipment in addition to pharmacies. I think this is a lot of laying the way to where the expertise that pharmacists has can become part of our system and become part of our billing system. And we really need to start paying pharmacists for their interactions with the healthcare system, with doctors and others, making sure that the treatment an individual says is appropriate, and that's an expertise that only pharmacist has. And thank you, Senator, for your work on this and as well, and hopefully we'll continue to move in that direction.
Thank you. Any other questions from the committee? I know we have one speaker. I'll recognize Penny Shelton. If you will step and introduce yourself, tell everybody who you represent, and you have about 2 minutes.
Thank you. I appreciate all of you. I'm Penny Shelton. I've been a pharmacist for 34 years, and I currently have the privilege of serving as the executive director for the North Carolina Association of Pharmacists. I want to thank Senators Sari, Heiss, and Galey for their primary sponsorship of this bill. Mainly, this bill has been needed for many years, and I really appreciate Senator Heiss's comments about how we've kind of have boxed in pharmacists with regards to thinking of them and their role as in dispensers of medications. Pharmacists have been trained and educated for many, many years. They're all for really since the year 2000, pharmacists have been graduating with a Doctor of Pharmacy degree, and our state has been greatly underutilizing their expertise in helping to keep medications used in a safe and effective manner. The greatest thing about this bill particularly is it gives the ability to expand to allow pharmacists to partner with physicians, nurse practitioners, and PAs to really be able to give more flexibilities around allowing pharmacists to help address population health issues. We think about chronic disease, things like diabetes, congestive heart failure, and many other chronic conditions that really escalate the cost of healthcare. Pharmacists can greatly help to reduce those healthcare costs, but not only focus on the cost, but also focus on the quality of life that patients are living and managing their healthcare conditions. And that is the greatest role that this bill can do, is really to expand those flexibilities and also be able to move. We're utilizing clinical pharmacists primarily in our health systems and in our medical clinics, and we need to figure out greater ways to be able to pull that out into the community, particularly in rural areas where the community pharmacy is the primary point of access to care. Pharmacists that are working in our independent pharmacies or community pharmacies have the same education as our pharmacists that are working in healthcare systems. And so what we want to be able to do is to allow physicians that are interested in partnering with pharmacists to address these chronic diseases and other healthcare needs in our community and in our healthcare systems to be able to have greater flexibility in putting together their collaborative practice agreements. So I want to thank each of you for addressing this bill. It has been a long time coming to try to get to this point to expand this ability for pharmacists working with all other medical providers in addressing medication issues with patients in our state. So thank you very much.
Thank you, Michelle. Any other questions of the bill sponsor? Senator Settle.
I just have a comment. Coming from a very rural area and also having a daughter that is a juvenile type 1 diabetic, that I do appreciate this
Yes,
to
he's
greener grass. I noticed his new seatmates are reminding him to vote as well as Brad and I used to. So.
Thank you. I just want to make a comment too. And I appreciate everybody on this health committee and what all's going on in the state. And somebody asked me about healthcare, and I said, you know, we're really focused on healthcare and healthcare costs because all of us, I think, want North Carolina to go from worst to first in healthcare. So thank everybody that's working on a lot of great bills on healthcare. All right, we have a motion from Senator Adcock with a second from Senator Corbin. And the motion is for a favorable report for the bill with referral to rules. All in favor say aye. Aye. Any opposed? Thank you, sir. Good job. Now we'll hear Senate Bill 445, Senator Jarvis. Welcome, Senator Jarvis.
Thank you, Mr. President and Health Committee members. It's great to be before you today. Senate Bill 445 is basically aligns anytime we go into a national declared emergency or disaster, it will allow the North Carolina DHHS rules to automatically align to the waivers of the federal government. And this is in regards to the hospitals so that we don't have to go through the process and the timing to try to make things work in a speedy way. And Mr. President, I believe there's an amendment.
Yes, sir, and I would like to send forth the amendment. I think everybody should have it. S445-ABC-36 version 1. And would you like to go ahead and explain the amendment?
Yes, the amendment basically is collaboration between DHHS and the North Carolina Healthcare Association. And what it does, it just is basically a technical amendment that draws down to the fact of the corresponding rule rather than just leaving a broad nature of all rules, whichever corresponding rule is released or waivered.
We do have a motion for the adoption of Amendment ABC-36. All in favor say aye. Any opposed? Is there anything else you'd like to explain to the bill? All right, I'll open it up for questions. Anyone have any questions about the bill? Is anyone in the audience who would like to speak to the bill? All right, do I have a motion? Senator Adcock made a motion, and the motion is, may I read it?
Yes, sir.
Motion for a favorable report for the bill as amended, rolled into a new PCS, unfavorable to the original with referral to rules. All in favor say aye. Aye. Any opposed? Thank you, Senator Jarvis.
Thank you so much.
At this time, I'll turn the chairmanship over to Senator Galey, and I'll be presenting the next bill.
Senator Bergen, please proceed when you're ready.
Thank you, Madam Chairman. Senate Bill 527 amends laws that deal with the local management entity, managed care organizations that we commonly call LME-MCO employers. And what this bill will do, it'll exempt local management, LMEs, employees other than senior management from the compensation-related provisions of the State Human Resources Act. In doing this, this defines LME-MCO senior management as the area director, chief executive officer, chief financial officer, chief operating officer, chief compliance officer. Pretty well it's everybody in the C-suite except the medical officer or substantially equivalent positions. This comes at a request from the LMEs to have greater flexibility in hiring employees. We've discussed these provisions with the director of the Office of State Human Resources, and she is supportive. We have met with her in the office to discuss this. Next, it removes the requirement of counties to approve salary plans for the LME-MCO employees, including senior management, when the salary plan for the employee exceeds the highest paying salary plan for a county within the LME-MCO's catchment area. Finally, it removes the requirement that LME-MCO operating medical, behavioral health, and intellectual development disabilities tailored plans, contracts, that they must must contract with a prepaid health plan operating a standard benefit plan contract. We are told by the LMEs that moving the statutory requirement from shall to may will provide many cost savings and flexibility to allow the LMEs to enter into partnerships that they see as most effective for providing services. What we have is a lot of the LME MCOs can't hire people. You know, the salary range and the time that it takes to hire people using the state requirements. When I was meeting with the Secretary Stacy Meyer over the OSHR, she was telling us that it takes up to 90 days to hire people. She's trying to get it down to 45 days. I've challenged her to get it to 30 days so that we can get people hired, get them working for the state, and get these people taken care of. But I wanted to leave the C-suite in that system so that we can make sure that those salaries are looked at and watched. And I'll be happy to answer any questions about this.
Senator Bergen, did you have an amendment?
Actually, the whole bill is pretty well an amendment. So I'd like to send forth the amendment, and then I can answer any questions. So I think you have a motion. I'll send forth the amendment, and I think you have the motion.
I believe the amendment is before the committee. Do you have anything further to explain the amendment?
No, just to answer any questions that anyone might have.
Are there any questions about the amendment? Senator Adcock.
Thank you very much. Thank you, Senator Bergen. What's the major difference between the bill that we saw before coming today and the amendment?
There were some questions about the C-suite. You know, it was going to remove pretty well everybody, and I just think that those offices, those positions, ought to still be within the purview of the state.
It's an oversight issue, right?
Yes, ma'am.
Thank you, sir.
Anybody else? Questions on the amendment? Senator Waddell.
Thank you, and thank you so much for clearing that up concerning the questions that we had on this bill previously, and at the appropriate time, I move for approval.
Thank you so much. I will say there's still a couple of questions. We talked to some of the PHPs. There's a couple of questions about some contracts, and we're working on that, so there may be an amendment coming forward later. But thank you for your support.
So seeing no further questions or comments, all in favor of the amendment, please say aye. Anyone opposed? Before we continue with the bill, I want to pause for a moment and recognize our Senate pages have come in. And I'm going to read your names. Hopefully I won't butcher your last name too badly. If I do, I apologize in advance. If you could stand up and give us a little wave when I call your name, that would be appreciated. So Naomi Anglin from Burnsville, North Carolina, sponsored by Senator Heiss. Stefan Aragona from Jacksonville, sponsored by Senator Lazara. Gina Bayon from Oak Ridge, sponsored by Senator Berger. Asher Trout from Greensboro, sponsored by Senator Robinson. Sam Hollingshead from Raleigh, sponsored by Senator Chaudhry. Jackson Kissia from Wake Forest, sponsored by Senator Everett. Elijah Matthews from Clayton, sponsored by Senator Sari. Christopher Pedro from Morganton, sponsored by Senator Lowe. Adia Saki from Mooresville, sponsored by Senator Sawyer. Reese Stevens from Raleigh, sponsored by Senator Adcock. Kavya Subramanian from Charlotte, sponsored by Senator Bradley. Kate Taylor from Wake Forest, sponsored by Senator Everett. So hopefully I got one or two of those last names pronounced correctly. And thank you for being here. We're so tickled that you could join us for these few days, and I hope that you've had a good experience and have a lot of fun things to take back to your homes, your school, and your community. So thank you. So we have Senate Bill 527 before us as amended. Is there any further discussion or debate on the bill, which is the only thing that's keeping us from going home now?
The only thing I would like to say is I'm really impressed that you did. I think that's the most anybody's ever entered, most pages anyone's ever introduced and got the names as good as you got them. Wonderful.
Well, thank you, Senator Bergen. We always trying to have a growth mentality and do better. So Senator Waddell has made a motion for a favorable report for the bill as amended, rolled into a new PCS, unfavorable to the original, with a referral to rules All in favor, please say aye. Aye. Anyone opposed? Motion carries, and we're adjourned.